Our Angeline McCall spoke with one family near Coopersville about how they hope it could change their daughter's life. Angeline?
Spinal muscular atrophy, also known as SMA, is a type of neuromuscular disorder caused by a gene mutation. It can result in things like muscle weakness to the point that it can paralyze children. And it is the #1 genetic cause of deaths in infants. And one drug with a big price tag hopes to change that.
Every kid should have a chance at childhood.
Good job.
That's why Sienna's parents help her with everything they can. Shane and Emily Hopevluer only want to give their 17-month-old daughter a future without limitations.
Just as long as she's happy, I mean, and I'll help her do whatever she needs to.
Sienna hasn't crawled or walked on her own, needs a feeding tube, and just recently started saying her first words.
And she likes to say dada a lot, so I like that.
Shane and Emily first noticed at 2 months old that their daughter was weak. She couldn't roll on her side, so they planned to visit a doctor.
I don't even think they made it to one appointment, and then we ended up in the hospital with her not breathing.
A couple of months later, doctors diagnosed Sienna with a genetic disorder called spinal muscular atrophy, or SMA. Soon after, she began taking a drug called Spinraza, given through a needle in her spine every 4 months. It slowly helped her accomplish the big milestones the smallest of babies should make.
Oh, no, great. No, it's just mama.
Like talking.
Mm-hmm. Yeah, we had PT this morning.
Even sitting.
Now she's sitting like 30 minutes or more at a time, sometimes it seems.
All she wants to do is be up now.
Yeah, she wants to sit up and see the world.
In November, though, Sienna became the second patient at Helen DeVos Children's Hospital to ditch Spinraza for the newest drug on the market.
You don't like your blood pressure?
This is video from her hospital visit when she got her one-time dose of Zolgensma.
So is that the most expensive drug you ever held?
The drug replaces the gene Sienna is missing, and it costs $2.1 million.
It's in, baby. Sienna, can you go, yay!
Primary insurance denied the coverage twice. Medicaid picked it up instead. But that battle with insurance isn't over yet.
Hi.
Stress, anxiety, worry. More so now because we know what can happen if he gets it right away.
He is baby number 2, found to have the same condition.
Just worrisome because we know the struggle that it was to get where we are with her now.
Doctors have told the Hopevluers their son may not show any signs of SMA if he can get the drug within a few weeks of birth.
Total lifestyle change. I am not having to worry about double the medical issues and just knowing he's not gonna struggle like what she did or has.
Sienna has learned the mask and the gloves mean mom is coming.
I think so now.
Emily can't get too close though, because she could develop the same antibodies as Sienna.
Just trying to be precautious, I guess.
Meaning her unborn son could become immune to the Zolgensma treatment before he gets it. In fact, for a total of about a month, Emily won't be able to hold her baby closer than this.
I'll still be really cautious of, washing my hands and everything afterwards, but it's just right now. I could do it right now, but I'd rather just not, to be safe.
In a best case scenario, the drug will give their son a chance to live without medical appointments or equipment. And for their daughter, it could mean a chance to walk one day.
I just hope that she's not going to be limited in what she wants to do.
A drug putting a cost on childhood, but also giving a chance at freedom.
We reached out to the manufacturer of Zolgensma to ask why this new gene therapy treatment is so expensive. They told us as a single one-time intravenous infusion designed to provide a long-term benefit. Zolgensma's price reflects the long-term value it brings to SMA patients, families, and to the healthcare system. The gene therapy is priced at approximately 50% less than the current 10-year cost of chronic SMA therapy, which is, by the way, the same drug Sienna formerly took that alone costs $125,000 every 4 months, which evens itself out over the course of 4 years. In the studio, Angeline McCall, Fox 17 News.